Hello, this is Marla Dalton, Executive Director and CEO of the National Foundation for Infectious Diseases, or NFID. Welcome to Contagious Chronicles by NFID, featuring insights from trusted experts on the latest developments in infectious disease prevention and treatment. Joining me today are two esteemed colleagues and NFID leaders, Medical Director Dr. Bob Hopkins and spokesperson Dr. Bill Schaffner, to talk about recent vaccine recommendation updates for the upcoming respiratory season. So thanks again so much for joining me, Bob and Bill.
Happy to be here, Marla.
Good to be with you all.
So Bob, we've seen an increase in COVID-19 cases this summer, as well as the emergence of new variants. What are the current recommendations now in terms of COVID-19 vaccination?
Yes, Marla, we're seeing an increase in cases as we record this in early July. Unfortunately, far too many in our society are not up to date on COVID vaccination. I'd recommend that anyone who's 6 months and older and hasn't received the most recent vaccine, which has been available since September 23, get a dose. In addition, persons 65 and older who have been vaccinated with the 23-24 vaccine but have not received a dose in the last 4 months, and persons who are immune-compromised who have not received a dose in the past 2 months, discuss an additional dose with their healthcare team. We should have a new version of COVID vaccine focused on the current Omicron variants available late this summer or early fall for everyone 6 months of age and older, after these new vaccines are authorized or approved by FDA. But we need to focus now on protection for the current summer increase in COVID disease. While we don't have evidence that current strains are more severe, they continue to cause many illnesses, hospitalizations, and unfortunately, deaths.
So, Bob, just to be perfectly clear, does that mean that those who are at risk and have not received an updated vaccine should get one now and then expect to get another this fall?
Absolutely, Marla. We have far too many who are not protected at present.
So, Bill, can you help us understand the updated flu vaccination recommendations, including those specific for organ transplant recipients?
Sure, Marla. We know that flu is our annual nemesis. It causes an outbreak every winter here in the United States, and the recommendations are the same recommendations we've had for the last about 10 years, namely that every single person in the United States age 6 months of age or older should be vaccinated against influenza this fall or winter. In particular, those who are age 65 and older have a preference for high-dose vaccine, adjuvanted vaccine, or recombinant vaccines. These vaccines have a bigger punch to the immune system. They work a bit better in that population that's age 65 and older. There are new recommendations regarding people who are younger than age 65, 18 to 64, who have organ transplants, and they now may also receive high-dose or adjuvanted vaccines because it works better in those persons whose immune system is suppressed. So those are new, solid recommendations for organ transplant recipients.
So, Bob, there was also a change regarding RSV vaccine recommendations for older adults. What are you now telling your patients about RSV prevention, both older adults as well as pregnant women and parents of young children?
RSV vaccine recommendations for older adults were modified by the CDC last month. These changes importantly focus and strengthen use of a single dose of RSV vaccine in older adults who are most likely to benefit from the vaccine. This includes adults 75 and older, and those 60 to 74 who have risk factors for severe disease. While some who would have qualified for vaccination under the old shared decision-making guidance may be concerned about the change, this change follows the evidence. We're targeting the vaccine to those older adults most likely to benefit. Now, for pregnant women and infant protection against severe RSV, our guidance has not changed. Women who are 32 to 36 weeks pregnant from September through January should receive RSV vaccine so that they can pass on that immune protection to their infants. And infants born from October through March to women who didn't receive RSV vaccination should receive the monoclonal antibody nirsevimab to protect them against severe RSV. And selected high-risk infants should also receive nirsevimab in their second year of life as well, an important topic to discuss with your pediatric care team.
So, Bill, we know that older adults and those with certain chronic health conditions are also at risk for severe pneumococcal disease. What can you tell us about the new vaccine option for protecting adults against pneumococcal disease?
Yes, Marlon. The family of pneumococcal bacteria are the most common bacterial cause of pneumonia that we have, and they can also cause meningitis and bloodstream infections. So they're very important infections that we'd like to prevent. And there have been some long-standing recommendations that people who are older than age 65 should, all of them, receive pneumococcal vaccine, and those younger than age 65 who have certain underlying chronic illnesses such as asthma, diabetes, heart disease, lung disease, any kind of chronic disease should also receive pneumococcal vaccine. Now, you mentioned that there's a new vaccine out there. It's actually designed particularly for adults. The pneumococci come in various strains. They're technically called serotypes, but these strains are included in the vaccine, and there's one now just released that's tailored particularly for the strains that are more apt to cause disease in adults. And it's called PCV21. So this is a vaccine that can also be given to adults, and it may be the one that your healthcare provider is using at the present time. Please ask them about that, because it's a vaccine that's now recommended for everyone who previously had the vaccine or who qualifies for pneumococcal vaccination.
So are there any other closing thoughts or advice that either of you would like to share?
I would start with everyone 6 months of age and older needs an updated COVID and flu vaccine this fall, and that persons at high risk need RSV vaccination, and we should talk to our healthcare providers if you're older or have medical conditions, and that you may need pneumococcal vaccination.
And I would just say, Bob, you've said it all.
Great. Thanks again, both Bob and Bill, for your valuable insights. And thank you all for tuning in to Contagious Chronicles. If you have a burning question for an NFID expert, please submit it via the online form at nfid.org/contact. Your question may just show up in a future episode of Contagious Chronicles.